because I think that's the biggest challenge is going away from a traditional career like medicine, where it's very defined. Like it's very defined how to become a super successful, super specialist doctor, and the pay is very good as well. It's very difficult to leave that into something that isn't as successful, because that's what I found. So my first product failed woefully. Right? My expertise was in chronic disease, and so I said, "Oh, I'm going to build some fantastic software to help coordinate chronic disease and prevent and manage and blah 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 blah, all the buzzwords." Built that, failed. All the code we wrote never got used really. So that was my first lesson: is don't write code early on. Actually figure out the problem, build a solution that isn't code based, that actually is a solution that works, that has a value proposition, and then transition that into something technology based. So after kind of a couple of failures, started to think more deeply about actually first principles. How do people think about healthcare in Africa? And that's where kind of what WellaHealth is now today started to emerge. So it's working with community pharmacies. So we went in there to try and digitize some of their interactions. We're relatively successful early on, had about say 200 community pharmacies, so small businesses using our software. That was one thing I learned early on, is to not outsource your software development, because it's going to change so much that if you're paying a shop to do it, the costs add up and you're never going to use that code, right?
Hello, everyone. On today's episode of Africa Tech Talks, we are honored to welcome a trailblazer in the healthcare digital sector, Mr. Ikpeme Neto. As the founder and CEO of WellaHealth, a pioneering health tech company, Dr. Neto has embarked on an extraordinary journey to revolutionize access to quality and affordable healthcare across Africa. With a diverse background in medicine, business, and entrepreneurship, he has harnessed the power of technology to address pressing healthcare challenges, leaving a mark on the lives of countless individuals. So join us as we get into Neto's inspiring story, from his roots as a medical professional to his entrepreneurial ventures, and uncover the driving force behind WellaHealth's branding break solutions. So, Ikpeme Neto, thank you so much for coming to Africa Tech Talks, and welcome.
Thank you so much. It's a huge pleasure to be here.
It's our pleasure.
So let's start uh, with your origin story. So can you share a little bit more about your background and what inspired you to pursue medicine initially?
Absolutely. Yeah. So I think it's, cliched. I was a young kid that wanted to help people. So what better way to help people than to get into medicine? So for as long as I can remember, I always wanted to be a doctor. And my parents tell me, I was a little kid when, a family member had some healthcare challenge, and I said, "Oh, I'm going to fix that someday. I'll be a doctor." So very cliched, right? But I do always remember wanting to be a doctor. I think practically though, in school, I actually did enjoy the sciences first of all. So I, ended up doing science subjects in school, and I, was fairly good at biology and chemistry in particular. So um it was kind of natural enough that I'd go on to do medicine. And I guess I worked hard as well, because getting to medical school anywhere in the world is fairly difficult. And I ended up in the Republic of Ireland, where I was able to get into medical school luckily, and went through that process and trained to be a doctor.
Wonderful. So you don't come from a background of, well, we are talking today about mainly later on about your current endeavor, WellaHealth, but you
Mhm.
don't have a background of, so to speak, software engineering. So your background is from medicine. So you studied in Ireland in Trinity College, right?
Mhm. Yep.
In Dublin, and then you transition. So you practice for 4 to 5 years afterwards, after graduating.
Yes, exactly. So I practiced for about 5 years and sort of off and on for a few years after that. I always wanted to be, so I never thought I would do anything technology or even entrepreneurially. I honestly didn't think that. So if you, rewind to say when I was getting into medical school and you told me that, here's what your life would be like today, I'd be very surprised, to be honest. I didn't think that this was going to be the case. Having said that, though, I did grow up with technology. So both of my brothers, work in technology. They're both software cybersecurity people. And I grew up in the capital of Nigeria back in the 90s, and we had a computer at home, which is unusual, for a Nigerian family at that time. And what was even more unusual is we had internet at home as well. So in the 90s in Nigeria, that was my environment. So I guess it's not then, far-fetched that I would end up doing things in technology, because I was very comfortable with computers, very comfortable with the internet, understood how to find information online, how to interact with people digitally, all of that. So I think that certainly shaped my worldview, in that as a young kid, I was already exposed to the internet and technology in a very, intimate way that many others didn't. Also, then I think that I didn't realize that I was very entrepreneurial up until when I was trying to figure out what to do with my career when I was a doctor. And every kind of I saw really difficult problems in healthcare in Nigeria and across Africa. And I wanted to solve them, but I knew that sitting in a clinic on a day-to-day basis would not be enough to create the kind of solutions and impact that I wanted to see. And those problems would limit my ability to be efficient or work effectively sitting in a clinic. And so, as it turns out, that's very entrepreneurial, thinking about problems and being frustrated by them and trying to solve them. So, for me, it was just my personality where I hate not being able to like move things along. I'll get up and go solve it. And so, the combination of those two things meant that I was always going to be an entrepreneur in technology in healthcare.
Well, so interesting. So you mentioned that already in the 90s you had a computer and internet access at your home. That you said is not was not common in Lagos, Nigeria. I can tell you it was not common in many other places. Even when I was growing up in Portugal, not everyone had access to the internet in the 90s. So and that is really transforming for a young person. Well, the internet is not like it is nowadays. So
It's
the
very
internet of the
different.
90s,
Yes,
it's very different, right? So you still
yes.
remember the good, the search engines and the web pages, and
Mhm.
it was so little compared with the amount of information we have nowadays. Not to
It-
mention other things and other revolutions in technology. So you even practicing medicine, you always had this little bug inside you of entrepreneurship. So you were quite. So what made you transition from practicing medicine? Because that must have been quite a big decision in your life, right? So you initiated your life in medicine and transitioning that. What made you do that?
Yeah, it's a great question. So, first of all, I think it's my personality, of course. I always was frustrated by problems and I wanted to do something about them. And so it became very personal for me as far as healthcare in Nigeria was concerned, when it was my own mom that was having challenges with her own healthcare. And so I started to help her navigate it, even though I was, thousands of miles away. At the time, I was, training in medicine in New Zealand. And I was helping her navigate her healthcare in Nigeria. And I figured, oh geez, if I could do this for her remotely using technology and the internet, then maybe I can do this for many more people, and maybe this is actually the way to solve healthcare challenges across Africa using technology, because that was always my goal. I always wanted to be a doctor to just improve the healthcare in Africa, and I'd always thought I'd actually return to Africa doing some sort of public health. But technology seemed a lot more suited to my personality and the skills that I could bring. And so for me, it was seeing that while helping my mom and saying, okay, maybe this is what I should be doing full time. And then I started to look into it. When I first started, actually, I didn't think I'd do it full time. I actually kind of thought I'd do it on the side. I still felt I could do medicine and do this on the side. But the more I got sucked into entrepreneurship and technology, the more exciting it became, and the more boring and frustrating and distracting medicine became. And so it came to a point where I figured that, I was becoming a bad doctor, right? I would see a patient and I wouldn't wait for them to leave so I could open up my laptop and do something a lot more exciting. And so I said, okay, this isn't really great. So I better, choose. And I, decided to quit medicine and focused on this, exciting thing called technology entrepreneurship.
Well, so that's so inspiring, and thankfully you did the right choice because what you're doing
Well, the
with your
jury is
project.
still out. The jury is still out.
Too soon to say, too soon to say. But listen, congrats in everything that you are doing. It's wonderful, and our listeners will you'll share more later what you're
Mm,
doing and what WellaHealth is doing and the plans for the future, of course. But
mm.
so thank you so much for sharing this first part of your life and what motivated you. So I will now pass the mic to my colleague Victor. He has a couple of questions for you. Victor, go ahead.
In the sequence of this entrepreneurial vein that you discovered, or that ultimately you are developing with this Well Health project, I would like to ask before going into more detail in what Well Health is. Other projects have you done? Did you have any prior experience in trying other projects and learning with those lessons?
Yes, absolutely. So it's actually 10 years now since I made that decision to transition from medicine into, technology entrepreneurship. And in that time, I think I've built about 10 different products and projects. So
Right.
I'm very experienced in failure, right? Which is why I say the jury is still out whether, I've been a success or not. Um, but yeah, because I mean, there is no real manual, right, on how to do this, especially in Africa, where there are not many successful technology ventures you can point to. In fact, in healthcare in particular, I can't really point to a specific success in healthcare technology in Nigeria, certainly, and even across Africa. And so it was a path that there wasn't a clear way to go down. And actually, speaking of success, I think this is one place I think I want to say I'm successful. I like to think is most successful about what I've done is I think I've created a bit of a path and a story around making that transition for others. So even if my ventures fail, hopefully other people can take inspiration and follow some of the things that I've done so that they can be successful. And because I think that's the biggest challenge is going away from a traditional career like medicine, where it's very defined, like it's very defined how to become a super successful, super specialist doctor, and the pay is very good as well. It's very difficult to leave that into something that isn't as successful because that's what I found. So my first product failed woefully, right? My expertise was in chronic disease, and so I said, oh, I'm going to build some fantastic software to help coordinate chronic disease and prevent and manage and blah 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 blah, all the buzzwords. Built that, failed. All the code we wrote never got used really. So that was my first lesson: is don't write code early on. Actually figure out the problem, build a solution that isn't code based, that actually is a solution that works, that has a value proposition, and then transition that into something technology based. So that was my early introduction. And I had a small team then that, I don't think we were very well aligned. So ended up getting rid of that team and then just going it myself to figure out what the heck am I doing. Because I think when I started off, it was very undefined. And I myself hadn't articulated what I was trying to do. So that
Mm.
first failure said, okay, maybe you need to articulate things better and understand the focus. So I dug a bit deeper and started to focus on specific areas. So first of all, it was working with healthcare professionals. I said maybe laboratories are the way to go. I was looking at trying to use data to give insight into to patients and healthcare professionals to improve the management of chronic diseases. And so I said, okay, the place that spits out the most, objective data are labs. So we went into labs to try to digitize them. And again, very quickly, we found that there were lots of challenges there. Lots of it were around the business model is how do you make this sustainable so that the patient gets value, the providers get value, and us, the business, gets value as well. It was very, very difficult because, and we'll talk about this a little bit more, is that the healthcare market is very constrained. People will only pay for curative stuff. There isn't a lot of margin, a lot of room to pay for kind of bells and whistles and extra things. And that's what we found is that we're building a lot of bells and whistles, a lot of vitamins are not painkillers. So again, failed there. So after a kind of couple of failures, started to think more deeply about actually first principles. How do people think about healthcare in Africa? And that's where kind of what Wella Health is now today started to emerge. So it's working with community pharmacies. So we went in there to try and digitize some of their interactions. We're relatively successful early on, had about say 200 community pharmacies, so small businesses using our software to manage their customer interactions and customer data. So that was kind of the early flavor of failure that I had at Wella Health.
You were doing that alone, or did you have a small team engaged with you also in that in those experiences, in those challenges?
Yeah, so I initially had a small team, but like I said, weren't very aligned, and that was totally my fault, not theirs. I didn't define what I wanted to do, so of course we failed. So I got rid of that team, except for my friend, Australian software developer, who was the one always building the code for us. And that was one thing I learned early on, is to not outsource your software development, because it's going to change so much that if you're paying a shop to do it, the costs add up and you're never going to use that code, right? And because you've spent so much money on it, you don't want to lose that code. You're going to keep trying to use that code. And that is a
Yeah,
recipe for significant
yeah,
disaster. So
yeah.
I was lucky that I had a friend that was able to come and build code for us for equity, So because I did try and learn to code, but I very quickly realized that my skills were better spent elsewhere than learning to code. So with him, I was able to recruit a local team. He was based in Australia, and then he went off to do his own thing. But he was able to help me recruit a local tech team in Nigeria when I returned. And so with that local tech team, hired a couple of people in sales, and then we just started to build things and sell them. And slowly but surely, started to get some traction. We pivoted a bit more to using the pharmacies as a service layer to service health insurance companies and affordable healthcare plans. And that is where things really started to take off. And that was back in 2019. And so that is kind of where we are at today with Wella Health, which is, you know, working with health insurers to help them to service their customers using community pharmacies, and then selling also very affordable healthcare plans that start at less than $1 a month, covers common conditions, offers care within community pharmacies, and uses telemedicine to make sure that everybody has access to great healthcare.
Great, great. So it seems that you had 5 years of an MBA on real
Exactly.
entrepreneurship.
Yeah, that's right. And real
until
MBA, not the stuff they teach you in the school.
right, right, until you get to Wella Health. So tell us more about Wella Health. You mentioned a little bit the how did it start, but yeah, the main purpose, the dream behind, and how it works actually. Yeah.
Yeah, great question. So for me, the vision has always been, I mean, I sat in, hospitals in the US, in Europe, in New Zealand, and I saw how people were getting really good healthcare. And it always bothered me that people back in Africa didn't get the same access. And I said, well, we're all the same, we're all equal. Why shouldn't Africans get the same quality of healthcare that people are getting all over the world? And so that was always my driving vision, is I want
Right.
to provide that same access and quality to every African. Now, the challenge that, when I came back and then started to build all these things, the challenge that I found is the financing of healthcare is very, very difficult in Africa.
Yeah.
So lots of us in Africa pay out of pocket for healthcare. In Nigeria, it's about 70%. In Angola, I think it's about 30 odd percent. Across Africa, it's fairly high. Now, the challenge with that is it's very expensive, the quality is very variable, and the system is very poorly organized. Because if everybody is going to pay themselves out of pocket for healthcare, there is no incentive for organization, for quality, for resource allocation in a way that is efficient for everybody. So that is the underlying problem that we saw. And so we said, can we actually help to figure out this financing layer for healthcare that we can build everything else on top of? And how we started to do it was thinking about the supply side, so aggregating the suppliers. So for us, it was community pharmacies. So aggregating community pharmacies that would then help to provide care. Then going to the demand side, which is out of pocket, but also health insurers. So aggregating the demand side, so working with health insurers to say, let's help you take your patients and put them in an efficient network of supplies of healthcare supplies, which is the pharmacy that can give them consultations, give them testing, give them drugs, make it efficient using our technology so we can manage tens of thousands of people every month. You don't have to do it manually, because that was the big problem. Is it's very manual, it's very fragmented. There's tens of thousands of providers, hundreds of insurers, there's papers flying everywhere, WhatsApp messages, emails, lots of call centers, no real technology integrating all of these. And so we're sitting in the middle. So we're building technology to get the demand in one side, supply on the other side, and match it efficiently so that everybody gets best value and best price. And that's what we're doing at WellaHealth with existing insurers. And then now that we have that efficiency in place, right? Because we have aggregated demand, good aggregated supply. The suppliers are happy because if I open a pharmacy today, or if I opened a pharmacy, say 5 years ago when WellaHealth wasn't there, it was a bit of, exercise in faith. I open the door, I get a good location and hope people come in. Today,
Yeah.
if you open a pharmacy, you can come to WellaHealth and say, listen, I've got this great location. If you've got anybody in this location, send them to me. And we'll do that
Yeah.
because we've got the demand aggregated. What that means then for you as a pharmacy, right, is you can actually focus on building a great customer experience, getting your drugs right, doing stuff the right way, agreeing price with one bulk buyer, essentially, and then just make sure everything works. So bringing a lot of quality, a lot of sanity into the system, and more efficiencies around pricing, right? Because before you were not sure of your revenue, you had to increase the margins, right? So every time somebody came, you had to make sure there was enough margin, just you never knew when they'd come again. But you have a consistent customer coming all the time. You're happy to reduce the margin because you know you're getting the volume through. So that means then is we can now reduce the cost also of the insurance, right? Because you're servicing the plans a lot cheaper. We can get low cost insurance and we can sell low cost insurance into the millions of people that don't have significant incomes, don't trust insurance companies, and are worried that if they pay now, they won't get care later. So we're saying, okay, pay
Right.
us a little bit and we will give you care when you need it. Yeah.
Yeah. And on the insurance companies, on the side of the insurance companies, how was the reception? Was it easy to convince them, or
It's
was it
never
hard
easy in
work?
this job. Huh?
Especially because it's a completely new product. I guess it was, yeah.
Yeah. Yeah.
They're
And
so
you know what?
traditional. Uh, yeah,
Yeah, I think one of the most
their
difficult
model.
things transitioning into, the work that I do now as a doctor is that when I was a doctor, people listened to me. I have a white coat, I have a shirt and tie. I say, "Oh, I'm a doctor, you have to do this." And people would listen. That changed once I said I'm an entrepreneur. Nobody listened to me anymore.
You lost your powers.
Yes, exactly. So that's a significant change. I don't think many people talk about that, but I experienced that. Nobody wanted to meet me, nobody wanted to talk to me. So things changed. So yeah, I had to learn to sell, I had to learn to figure out, the ideal customer profile, speaking about, early adopters, how to approach them, all those tactics, that nobody teaches you until you have to learn it the
Yeah.
hard way. I went and learned it. And so what it meant is I just kind of learned how to sell. And so initially it was very difficult. It was one, it was two, then three, then four, and now we have over 30, which is 50% of the market. Now we
Fantastic.
have insurers approaching us to say, we've heard you guys are excellent, we want to work with you. So thankful for that transition.
Yeah, awesome. Yeah, I guess that the insurance penetration ratio in Nigeria is quite similar to what we have in Angola, which is about 1% of the GDP. So
Mhm.
did this also contribute to a more, say, democratization of the insurance product or in the market?
Yeah, exactly. So yeah, we have a similar challenge. Insurance penetration is super low, and so the insurers. So it's not because there are no insurance companies. So there's over 100 in Nigeria. That is both on the
Yeah.
health side and on the kind of life and non-life side. So there's lots of insurance companies,
Mm.
but yet we're not able to penetrate the market. And so part of our job was actually helping the insurers to say, you got to think differently about the customer base. And they're not set up to think differently. And so we still find that a challenge. So what the insurance companies have done is they focused on businesses, so formal businesses, big industries, So a lot of the insurance premiums in Nigeria, and I'd say probably in Angola, are paid by the oil and gas companies, the
Mm.
maritime, the shippers, big businesses. They pay all the premiums. Now, if you have a business that is dealing with big businesses, that sort of a business cannot deal with your average guy on the streets that's selling mangoes. Like those two worlds cannot, they can't coexist. They don't understand each other. They don't speak the same language. They don't exist at all. You know, so again, we've come as that bridge to help the big insurers to say, listen, we understand, your challenges, your viewpoints. We also understand the guy on the street. We're the bridge to help this work. And I think we're starting to see some of that change, because the only way the penetration actually improves, like you've identified, is if the informal guys, the small businesses, the average guy on the streets can access insurance. And the model has to be different. It has to be, startups, technology companies like us that are innovating around the product, around the delivery channel, and around how people experience it.
Tell a bit also, how did you manage to mass market or to penetrate this idea into your customer base? In fact, because you did manage to solve the supply side and the demand side, and in the middle, how did you manage to make this, to convince the customers to adhere to a product that they don't see an immediate benefit of it,
Hmm,
only when they are really
indeed.
in the trouble?
Yeah, it's an ongoing problem. I don't have it solved by any means, it's on an ongoing problem, and some of it is cultural. And but what we've done is first is around embedding, and building trust. So when we got into the market, we found that the two biggest challenges, because on if you look annually on the spend, right? If you pay out of pocket and if you pay us premiums, the spend is equivalent. In fact, we're actually cheaper for a lot of people if you go a lot for healthcare. So it's not a matter of people don't have money. They're spending the money anyway, right? That's the
Yeah,
first thing. Because people are like, oh, you're building insurance, in a market where incomes are low, people are not going to spend that extra money on your product. And I say, no, they're already spending the money. I'm not asking them to spend new money. They're already spending it, but they're not spending it with us. And the reason is twofold. One is education, right? So that kind of financial education and understanding of, okay, if I pay a premium, that reduces my risk, and then over time it's a better way for me to run my life, as opposed to waiting for the risk that could be significant and wipe me out. So one is just that education. But the second, which is more important actually beyond the education, is trust, because people will still use a product they don't understand if they trust it. That's what I've learned, is people don't need to understand a product actually to use it. They just need to understand, or they just need to trust that whatever you promise them, you will deliver on it. And you need to be consistent in showing them evidence of that trust. And I think that is what the industry has failed to do, is that when somebody pays a premium today, when they come to claim in a year's time, there's always a story. Oh, you don't have this form. Oh, you don't have that file. Oh, you didn't do this. Oh, you didn't do that. The insurance thinks, oh, we've saved ourselves some money by not paying this claim. But what they've done is they've actually eroded trust in the customer and the marketplace. And so the biggest challenge we found is when we go to people, they say, listen, not only is this thing too good to be true, but I know that if I give you this money, you're never going to be there when I'm sick. And so trying to overcome that barrier of trust is really a huge challenge. How we're going about it is working with existing brands and businesses that people know and trust, and embedding in them. And across Africa, it's the big businesses that people interact with all the time. Banks are very well trusted in Africa, in Nigeria in particular. Mobile network operators, again, very well trusted in Nigeria and in Africa. So our tactic, and what we're seeing be successful, is how do we embed with banks and financial institutions, so that when you take a banking service, whether it's a loan or some sort of account, you can have an insurance plan embedded in there. And then when you experience the claim, enjoy it, then you can voluntarily buy extra cover. And also with the telco, the mobile network operator, say when you buy a data plan, when you use a certain amount of services, there is an embedded insurance product that you can benefit from. And again, you're seeing this also models happen with say ride hailing and a few other big enterprises. It's just how do we get people to use a trusted vehicle to understand and experience insurance so that they can then come and say, okay, I'm going to voluntarily buy this myself.
Hmm.
Right.
Hmm.
Yeah. And this is really the key issue,
Yeah.
the trust in the whole system. Yeah. Thank you very much. I will hand over now to Andre, who has some additional questions to you.
Thank you, Victor.
Thanks.
Ikpeme, you were talking about how WellaHealth became a trustworthy partner of the people in Nigeria through being more simple, probably than the rest, creating this bond with the people, using technology, using this proximity that technology made possible in the past years. Um, but there's another thing that I'm interested in knowing.
Mhm.
Everyone is saying that data is the new oil. Nigeria is known very well for its oil
Mhm.
production. Throughout all the pharmacies, throughout all the interactions that you have, what type of data has helped you, or what data have you gathered that helped you to develop WellaHealth, and how has this influenced your path in this endeavor?
Yeah, no, totally agree that data is key. So a lot of our pivots have been informed by data, right? So at every step of the journey, we're always looking and saying, where is the opportunity? Where is the data? How do we harness that? So a prime example is when we were providing CRM solutions to pharmacies,
Mm-hmm.
we had about 300 pharmacies on the platform, and we experienced this challenge of kind of getting over, Jeffrey Moore calls this the chasm, right? In that technology adoption life cycle, he talks
Mm-hmm.
about, you can get into early adopters, but there's an early majority market that you really need to get into for your product to take off. But there's a huge chasm that is difficult to overcome, and we saw that firsthand. And we thought, okay, clearly our product isn't doing a good enough job to solve a deep enough problem for the people in the majority of the market. What can we do? So we looked into our data. And what we saw consistently was that the pharmacies in our network were delivering a lot of malaria care. They were selling so many malaria medications. And we thought, okay, maybe this is what we should focus on. Can we provide a malaria care solution delivered within pharmacies that enables us to access a majority market? So that was kind of the early part of how we got into this insurance business. Is we actually created a malaria insurance product. So I'd say we're arguably the first in Africa to have created a product, a malaria insurance product, where you paid a small amount and then we covered all your malaria costs, treatments, tests, etc., based on that premium. So that was very much driven by data. And it turned out it was right, because then when we did that, we had an insurance company reach out to us who said, oh my gosh, we've been trying to figure this out for a while. I'm glad you guys have the service components. Can we plug in and can we do it together? And then we're able to then attract more pharmacies on, because what we did is we flipped the model away from a SaaS solution for the pharmacies into a way for you to attract patients, provide them this service, and then the SaaS solution was embedded in it and you could pay for an upgrade. So that's kind of a very clear example of data helping us. Currently, we are collecting a lot of data, but as you can imagine, we're so busy doing the actual work that sometimes the data is hard to actually take advantage of. So I know, for instance, my engineering team, they're building some machine learning models using that data to enable us better predict pricing and availability information for medications, because that is something we struggle with. We are It's difficult to get live inventory data for a number of reasons across. We work with 2,000 pharmacies. It's very difficult to get that information. And so what we're doing is we've got a lot of historical data, and a lot of other data that we can then use, machine learning models to use to help us around predicting and matching, supply and demand. So that's, some ways that we're currently doing it. But I know there's a lot of value in the data We just don't have the bandwidth now to do it. We're just kind of running around trying to sell and stay alive, as a business.
Being an entrepreneur is normally very hard, as you say. No one wants to talk to us, and no one cares. But it's somehow a life of also catching the opportunities. And data has been, as I understand, a big opportunity for you. How did this knowledge of the data help you to tailor the solutions either to the pharmacies or to the clients? And what has been the most important usage of that data?
Yeah. So great question. I think that the how is in understanding what people cared about and what the market was doing. So when I started out, I had very fixed and clear ideas about what the market wanted. And a lot of us professionals, we do that. We think we know better than the market. um, but as I collected data and I was, honest with myself, because sometimes you see data and you don't believe the data, or you're like, I don't know if that applies. So first of all, collecting it. Second, being humble, to say you're wrong, right? Um, and then understanding people's preferences. So for instance, when I started out, like I said, my expertise was in chronic disease, so diabetes, heart disease. I really wanted to pursue that. That's what I wanted to go. But the data was saying no, what people are buying, what people are experiencing are infectious diseases. That is where the market and opportunity is, at least right now. So we had to then pivot into going where the opportunity of market is right now. Now there's schools of thought that say you should stick with your vision, you should do blah 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 blah. But in Africa, I think it's really important, especially early on, to go with where the market is, where the opportunity is clearly. Because it's very difficult to convince people to give you money in Africa. They don't have extra money lying around, right? So that data says, here is where it is, and we're then able to kind of push and go after it. And it also meant that when we went to sell or try to convince people, we had the backing of that data to say, well, we know that here's what's happening. And you really need to come with us because that's where the opportunity is. And people were more likely to believe us and work with us. So again, I think the data just tells us where the market is, and then we can then actually tailor the solutions into that market and figure it out that way.
Especially to the pharmacies, probably, where you had to convince them that the products that they needed to buy was mostly malaria products and other infectious diseases
Yeah.
issues.
So because I
Um,
think I think the funny thing is
sure.
they intuitively know, but there is no data, and so it can be difficult for them to even tell you. You know what I mean? So because when you go, we're very biased. Human beings are very biased. If you go and talk to 10 pharmacies about, what their sales like and all that, like they'll tell you probably 10 different things. They're never too sure. But I could go back to them and say, I've got your data. Here is the real information. And like, I didn't know that. Or, oh, that makes sense. And then they kind of go with it. So
At some
yeah,
point, let me just ask you, if you at some point have the ability nowadays to predict some kind of uh, seasonal spikes of search, and you can help the pharmacies to be prepared. Also, you have some kind of preparation for the insurance so that everyone can be more well adjusted
mm,
to the spikes.
yeah. I mean, I think that's the future. We don't have
Okay.
sufficiently powered data. Nigeria is a big country. So, going to back to my, statistical, understanding is you need sufficient data to be able to do those types of things. At the moment, we can kind of guess, but there's not a lot of strength in what we can predict. But I'd say over time, as we aggregate more and more data, then you'll certainly be able to use those patterns to then confidently, because I think you want to do this confidently. I don't want to go to an
Mhm.
insurer and say, do this, and then 2 months later, like, why did you tell me that? It's hard enough to build trust. So,
Yeah.
you got to be careful. But I think over time, certainly, as that data becomes more robust, then we can definitely start to, do trends. And I think actually it's more of a public service, even at that time, where we will just be releasing information and insights publicly and even to the government around what we're seeing with regards to disease trends, medicine consumption, those types of things.
Basically you became a digital layer of the healthcare system in Nigeria, which is somehow interesting. You're just needing to add more data to your company so that you can ramp up that situation and grow and help more people to have a better healthcare, like is your mission, which is so profound. With all the knowledge that you acquired throughout your career, throughout your ventures, um, what advice would you give to other entrepreneurs, especially in this area of healthcare?
Don't do it. If it's early, run away. Yeah, geez. I mean, it's difficult, and if you're in it, you already know how difficult it is. There is no right answer, that's the problem. There is no book you can read to find out the right answer, So I think maybe two big advice I would say is, first, don't die, find a way to just survive. I mean, it's an obvious advice, but honestly, that's the one thing that is always true. Find a way to survive, because the road will be long and it will be tough. So be smart in the way you manage your resources so that you can always survive until when you can finally get the right answers to grow. And then the second is experiment a lot. Don't be afraid to experiment. Everybody will always have an opinion on whether you're on your pace of experimentation. What I found in my experience is that, so startup people generally know and like to experiment, healthcare people don't. So whenever
Hmm.
I talk to, I remember when I was starting out, it's not so much now. But when I was starting out, I would try to do a lot of experiments because I definitely bought into the kind of lean startup movement. And I tried to do, a lot of experiments. But a lot of experiments depends on who you talk to. When I spoke to tech people were like, "Oh, you're not doing enough. You need to do more, more, more." When I speak to healthcare people, they're like, "You're crazy. Yesterday you said one thing, today you're saying something else. What are you doing?" you know. So you're straddling these two worlds that are very different. Healthcare people do not like change. They don't like stories. They really are averse to that. So I think in healthcare in particular, I would say you want to be careful in straddling that line. You want your tech people, the people on the tech and startup side, saying you're not doing enough, and you want the people on the healthcare side saying you're doing too much. If either one of those groups are happy, I think you've gotten it wrong, because you shouldn't be experimenting too much and you shouldn't be experimenting too little.
Okay, okay. One of the visions about health that really changed even my own life is that before treatment you should take care of yourself,
Mm,
and you should not get to a point where you need to get any kind of treatment.
exactly,
Um,
exactly.
how do you see? Is there space in this area of the new tech and the digital to help people in Africa with this line of thought?
Yeah, so that's a great insight. The reality is that you don't need doctors, actually.
Sorry.
um, yeah, no. So for especially in this day and age, I mean, yes, you do need doctors. Some things will happen inevitably, but if you live a certain lifestyle, your odds of needing a doctor is quite slim. And that lifestyle is essentially watching what you eat, right? So eating healthily, making sure you have a healthy weight, and exercising, right? And that is both cardio, so making sure you have good respiratory, cardiorespiratory fitness, and also muscle, so strength training, exercising, eating healthy. If everybody did that, most doctors will be out of a job. But we know that human beings do not do that. We hate to exercise, we're lazy, we love to eat the burgers, the fried foods, and so it keeps us in the business. And I think that difficulty translates even digitally, is that initially when a lot of new and digital technology came, there was a huge optimism that it could actually improve and change things for people. But actually, it's a psychological problem, and so the solutions that have been successful have actually been more psychology related. Is how do you
Mhm.
help the human psychology to just eat healthy and exercise? I think it's a very difficult problem, and of course, the challenge we also have now is our lifestyles have changed so much. 50 years ago, 60 years ago, Our parents, our grandparents, they walked everywhere, you know, or
Yes.
they did physical activities as a part of their life, you know. You look at videos from, you know, the media in the 1960s in Europe, everybody was skinny and slim, you know. They weren't going to the gyms, they were just kind of walking around and just living, you know, life. But now the difference is, you know, urban areas have sprawled. We're living in suburbs and walking in different places, walking all the time. We have to drive. That's day-to-day physical activity is gone out of our lives. Second, fast food is everywhere. Calories are so cheap. Sugar is everywhere. Soft drinks. When I was a kid, I only had soft drinks like Christmas and my birthday. Now I have it every day for lunch, you know? So of course
Yes.
that's changed. Like the whole life has changed. And so I think if anything, we're going to be sicker. And it's worse in Africa where we've got infectious disease and we're also getting, you know, this chronic disease, this lifestyle condition. So I wish I could be more optimistic, but the reality is it's going to get worse and it's going to get worse quicker. You know, I've got patients now that are 35 and they have diabetes. We never used to see people with diabetes until they were 60. Now 35-year-olds have diabetes. So yeah, it's not looking good.
Neto, yes, I saw, and this is something that is worrisome for me, is that most people, most youngsters that I see in the African countries that I visit, uh, they're always drinking the soft drinks
They are,
filled with
yes.
sugar.
Yes. To be fair to them, is water is difficult to get that's clean and trusted. At least sugar, you know what you're getting. You know, but
But
you're right. There's so much soft
even
drinks,
so,
so cheap and everywhere. Yeah.
it's so cheap.
Yeah,
There's a lot of people consuming alcohol drinks,
exactly.
and I lost I lost a sponsor probably to the podcast. But it's true. You know, you at
Mhm.
some point you need to also educate the people, and probably it's that kind of data that you collect that you're going to get at some point that is also going to be able to be used in the policies by the government and by entities. And now we have so much impact from the SSGs. So you have to be really aware of community and everything. You're worried.
Yeah, it's true, but it's there's a tension between these two things, you know, because the problem with kind of lifestyle conditions is the decisions you make today, they
They're
become
going to impact.
apparent the consequences in 10, 15 years time, you know.
Yeah.
But, you know, governments get money from VAT, for instance, from taxes, you know, from increased consumption. So it's always difficult trying to convince government to say, you know, you got to stop promoting kind of sugar, alcohol, you know, forget the taxes you get from it because you're going to pay more in the future, of course. But now African governments don't pay, you know, they don't pay much for healthcare. It's us, the individuals, that pay for it. So we have to be smarter and say, you know, cut down on the sugars, be more healthy, because if I get a heart attack, the odds that my government will help me quite slim. The odds that my finances will suffer and my family will fairly high.
Yes, yes, that's another impact that normally healthcare has in Africa, because then everyone from the family has to contribute so that you
Exactly.
can. Otherwise, you don't have a chance, and that's where I think insurance is going to have to step up. And I believe that what you're doing is really helpful. So it's really incredible to hear that from you.
Well, so many incredible insights, Ikpeme. So we're almost coming to an end, but unfortunately, but that's an excuse for us to invite you again later on in the future, because I'm sure
Ab-
you will have some exciting news in the coming year, and hopefully you'll accept and come again on our pod. But let's and just to end here, let's focus in terms of the future. So,
mm,
what can we expect? Two questions, actually. So,
mm,
what can we expect from WellaHealth in the short and medium term? Um, uh, for new products, new markets. Of course, you can share with us nothing too secret, or you don't have to share your secret sauce or your secret plans for the near future. So
mm,
that's one thing. And also, you're doing something that uh, our previous guest also is doing, Marc Essian. You're also creating your own pipeline of tech talent. You speak to, you learned sales. You also actually teaching other people how to sell. So you have these workshops or boot camps. So
Mhm.
you're also creating that pipeline. I see. I'm starting to see that it's kind of a trend, right? More and more people are doing that, and I think that's very interesting. So, can we expect from WellaHealth in the short near term, and how do you envision the future of healthcare in Africa? I
Mm.
mean, you have incredible talent going abroad, so that's still, especially in the medicine
Mhm.
sector, right? So nurses, physicians, they're getting out of the country. So
Mm.
exceptional talent. There's a brain drain there. How AI is going to? Do you think AI is going to affect the healthcare in Africa? So upsides, downsides, and how do you see, for instance, the so-called developed world is getting more conscious on healthy habits. We have this now. The Americans have this Ozempic super drug.
Mm.
I think that
Mhm.
if they could, they would put Ozempic on the drinks of everyone since 10 years old.
Everybody.
So, but if that happens, some people might believe that all those industries that we know today uh, that might not be as healthy, they maybe will start to push those products to developing countries. That might be also, I don't know, danger, so to speak. So getting more
Mm.
exposed to what is the other world. So to sum up, WellaHealth, what can we expect from you and WellaHealth, and how do you envision the future of healthcare in Africa?
Absolutely, yeah. Thanks. So I might actually answer the talent question. So you spoke about the work we're doing about building talent. I'm really passionate about that, and because all that I am is a result of kind of all the training and education that I got from all across the world, and I know that not everybody is as privileged, as I am, and you find that the education in Africa sometimes isn't great for a number of reasons. There's not a lot of investment in it, and the real skilled teachers, the real skilled people are leaving. In my company, we've had a lot of people leave to go to to Europe, US, Australia over the last few years. And you find that the younger and junior people, their growth and learning and development is stunted, because a lot of learning is actually mentoring and support from people that are more experienced. And so we decided then to formalize this process is how can we make sure that we are creating a pipeline of talents, not just for ourselves, but actually for the broader ecosystem? Because what it means is that over time, when we go to hire, we are just able to get better and more talent that have other people to kind of learn from. And so that's influenced, we've got Wella schools, we call it. So it's a training program for software design and product management. And we're trying to put in more programs in there, getting young people who are smart and motivated, and we put them through a boot camp, if you like, that's very project driven. So there's some didactic components, very project driven, so people can learn. And then at the end, usually we start with a few thousand and end up with like 10. Right? It's free. But essentially, those people that get to the end are usually excellent people. They're very determined, a lot of grit, and they're actually able to pursue their own growth. And we hire them as well. Not all, but some of them. And so really, really, passionate and about that. And I want to scale this, to millions of people. So the other thing I'm passionate about is actually teaching. So if I wasn't a doctor, I'd be a teacher. Because there's nothing better than opening up people's minds with knowledge. So that's that. So for future plans, we want Wella Schools, our training program, to reach millions of people, because I think that would be a great, great thing to see, so that more people can create excellent solutions for the world and build a better place. For us as a company, my first rule is don't die. So my hope and goal is not to die. So that when you invite me back, I say, we're still alive, thank God.
Vital
So
signs are still up. Vital signs are still up.
exactly, exactly. But that's a key thing because I mean, as you know, across Africa, the economy has been terrible in the last,
Yeah.
6 to 12 or 18 months even. And we're really seeing so if currencies have been devalued in Nigeria. We had a 98% devaluation in 2023. And we are venture capital funded, we raise money globally in USD. So all of a sudden, we have to kind of do double the work to earn the same amount of revenue in dollars. And so this is a real challenge for me and for I'd say most other entrepreneurs, in Africa that are raising capital in dollars. And so, because of that, a huge focus for us, alongside all the things we're doing locally, is actually thinking how do we earn revenue in dollars? And that takes a number of forms.
Okay.
So, one is expanding, so not just dollars, but outside of just naira. So, even though there's been devaluation in Africa, it's not been as bad in some markets compared to us. So, Francophone West Africa, for instance, I think that devaluation has been less than 50%, probably closer to
Mhm.
20%, which is great. East Africa, not as bad. So how do we diversify our income into other African countries and also earning in USD? So our strategy is twofold. One is expansion. So would love to speak to anybody in any African country that thinks what we do makes sense and try to figure out how we launch in other African countries to diversify. We're looking at Kenya, looking at Francophone West Africa, Senegal, Cote d'Ivoire, essentially any big markets. So lots of people, high out of pocket expenditure for healthcare, and usually a singular main outpatient condition that can be managed in an outpatient setting. So in Nigeria, it's malaria. So if you have a high incidence of malaria, that's a great place for the business, not for the patients, but for the business, it's a great place for us to go to.
Of course,
Also,
of course, of course.
yes, mobile money penetration also really helps. And then for the diaspora as well is how do we help people of African origin or descent who are living abroad in the US, Europe, wherever, to actually send home healthcare, not just money. So we can be the intermediary that helps you manage the healthcare of your family members back at home. And we've started to build our product, few thousands of dollars in revenue, few customers, and that's looking promising. So those are the real focus areas for us and hoping to grow that.
Interesting. So, how do you see the future of? What is your opinion for now? How changing can be this malaria vaccine? We don't really know how effective it is right now, or all
Mm.
we know. But what do you think about that?
Yeah, so my reading of it the last time is that something about 73% sensitivity. So what that means is that not 100% of people will be protected, but also there is a booster that's required. So the immunity wanes. What that means is if you get a bit like your flu vaccine, right? So every year you need an annual flu shot. Bit different mechanism, but essentially you don't get one malaria shot for life and you're protected. What will happen invariably is you'll have to get repeated malaria shots. That's my understanding. The second thing then is it's an expense, of course. Who's going to pay for that? Where is it going to be paid for? And will everybody need it to get access to it? My understanding is that a lot of countries are thinking that they will pay for the most at-risk people. And the most at-risk people are children under 5 and pregnant women. Now, in a lot of countries, those vulnerable group already have a thing called SMC, seasonal malarial chemoprophylaxis. Big long phrase to say that in the high malaria season, if you're at risk, they will give you a tablet consistently to protect you. Now, that can be quite cost effective compared to doing a vaccine. So I think the challenge with the vaccine right now is that is it the most cost effective way to deal with such an endemic condition? I think the jury is still out on that because right now it's all studies, it's all experimental, so there's money funding it. Once that money goes away, government will have to pay, and governments have to weigh this balance between do I buy a vaccine that will, you know, significant cost, I might need a cold chain, and it will be difficult for me to administer it, or do I just get tablets to people to take every few months that is much cheaper to do and has an existing supply chain?
Thank you. Yeah, we had the same challenge with the COVID shots, and you mentioned the cold chain, supply. Not not in every country you can easily
Exactly.
set that up.
Yeah.
It might be most cost effective using those preventive, so to speak, tablets, right? Ikpeme, thank you so much for sharing your story, for sharing your journey. Our listeners will be delighted, I'm sure. You're welcome in Angola. We already know that you have mad skills dancing kizomba.
I love my
So,
kizomba, yes. So I'm coming
so
for sure.
anytime
Done.
before taking off and landing, you just give us a call and we'll be together. Ikpeme, thank you so much once again, and we'll invite you for sure on the pod, and our guests will, our listeners, sorry, will be delighted to have you once more time. Thank you so much.
Love it. Thank you. It's a pleasure.
Thank you. Thank you
Thank
so
you.
much.
Thank you. Yeah.